and Jill Biden. Jill, I know that you have, for so long, had such an extended family with all of the students that you teach in college, all of the students that, a lot of them who didn't even know that you were Second Lady of the United States. But through the years, you've built a relationship with these students. And I talk to friends who are mental health counselors, and they talk about the mental health challenges, not only from those affected on the front lines of the virus, but also from students who are isolated from their friends, younger people who are scared to death right now about what's going on in this pandemic and what it means for their family, for their fathers, their mothers, their grandparents, and even for them. What do you say to them, to those former students and, yes, future students of yours who are suffering through this pandemic right now?
Well, you know, it's real. I think that they are afraid. They don't know what to do. They are isolated. And even though I'm not in the classroom this semester, I hear from my students every single day, you know, Dr. B, I hope you're okay, or Dr. B, you know, I'm going through this or I'm going through that, and what should I do? And I think we need, you know, they need to feel that things are going to get better, that there will be help for them. The mental health crisis in this country is real. And I think you have Lady Gaga on later, and she's going to be talking about some of this. But I see it, and that's why I'm so proud that Joe, in his educational policy, is putting in more money so we can have more psychologists and counselors in our schools, because I've seen it for so many years, and I've talked to teachers across this country, and I say, what is the one thing that you need? And the teachers, the educators say to me, Jill, we need more help with mental health. And it's a big problem. And I think after this pandemic, it's going to be, it's going to be even greater. Mm-hmm. And so that's one of the things that Joe plans to address.
Look, Joe, one of the things that I think is the root of this, and I think it goes all the way down to our children, even the kids in grade school. Mm-hmm. They basically hear through either their parents talking or what they see on television that a president says, it's not my responsibility. He doesn't take responsibility. He's president of the United States of America. And guests think what even a kid in 8th grade, the president is supposed to be, they don't think commander in chief. The president is supposed to take care of things. And he says, I take no responsibility for that. It's not my fault. It's somebody else's fault. He's doing the exact, I know this sounds sort of strange, but mm-hmm. he's doing the exact thing we teach our kids not to do. Blame somebody else, not me, the other guy. Not me, the other guy. I mean, this is the president of the United States, and I can't have no proof of this, but every instinct in my body tells me people from the elderly in nursing homes all the way to a kid who's in home and from school in 6th grade says, well, who's in charge? Who's in charge? How's this thing going to get together? I know that sounds silly in one sense, but I really believe it's basic human nature. And so the president, instead of saying, here's my plan, this is what we're going to do, this is how we're going to get you tested, this is how we're going to do this is how we're going to... He doesn't take responsibility. And he says the most bizarre things. Yeah,
we're going to need so much healing to take place after this is over. And so Joe's not going to only be the commander-in-chief. He's going to be really the healer-in-chief.
Well,
Mr. Vice President, many say that history will look at this as a monumental collapse in preparation that led to the deaths of thousands of Americans. So I want to look back at what should have been done at this point in the crisis. What warnings would have stood out to you? What would you have in place organizationally right now? And would you invoke the Defense Production Act as it pertains to testing and supplies?
The answer is yes, yes, and yes. Look, we go back all the way back in the middle of January, toward the end of January. I wrote an op-ed piece for USA Today, saying this is what we have to do. This is coming. This pandemic is coming. We talked about it. It's not like I'm clairvoyant. It was clear on his face it was coming. We knew what was about to happen. And instead of acting, the president did nothing. I urged early on that he take what I know it sounds strange to people listening, but the Defense Production Act. What that means is in time of great crisis, the president has the ability to go into private corporations, public outfits, and say, look, I want you to stop making this and I want you to start making that. Just like in World War II it comes out of. And so look how long it took to get him to get General Motors to start making the ventilators. Well, we should have been doing that early on in terms of gloves and protective gear for our first responders, masks, gowns, and the like. And look at all the carnage that's occurred as a consequence of it. And we're risking the lives and losing the lives of the very people we're going to need to take care of the people who are, in fact, sick. The first responders. And, you know, what I'd be doing now, I would really empower a supply commander. I've been talking about this for a while. A general or an admiral who has authority to, in fact, decide what the entire supply chain is. One of the people directing that and creating that Defense Production Act to get these things done, and then figuring out how to distribute it around the United States where they are needed. It's not the governor's responsibility to make those judgments. And the Defense Production Act for banks to make sure. I talked with Stephanie Ruhle a week or so ago. What I've been worried about, and she and I talked about, is the fact they got to prioritize lending to small businesses. The mom and pop businesses are going to go out of business. They should be the ones who are making sure they're able to stay open. They're able to come back in and be in play. I mean, you know, the outfit that has 4 employees, 10 employees. Small businesses are under 500. That's important. I get that. But how about all those people in every town in America? You walk down Main Street and all those places are closed. What about those people? They need help. I'd establish a pandemic testing board to finally solve the testing problem. I mean, literally a board set up to do nothing but get the product that is needed, the tests that are needed, the laboratories. I'd have the private and public laboratories collaborating to move rapidly on testing. And I'd open up an enrollment period for the Affordable Care Act. Give people the notion that you're not going to walk away from there being able to have health care. And I'd collect more data on what's happening in African American and you know, minority communities where the death rate is alarming in those areas. These are the things that we should be doing now, so that. Oh, anyway, I'm sorry. It's just frustrating, and some of it seems so obvious to so many people.
Mr. Vice President, Dr. Biden, Willie Geist, good to see you both this morning. You talked about people's fears, Mr. Vice President, and you've also talked about the dignity of work in this country over the course of your career. The fears are not just, as you just pointed out, of getting sick. They're of losing their livelihood, of losing that dignity to go to their jobs. They're worried about making the rent this month and getting the help they need for their kids and their families. So there are a lot of people in this country who are listening to President Trump right now and saying to themselves, well, if he wants to start to open parts of the economy and maybe get me back to work and get food back on my table, well, that's good news. So what would you say to some of those people, many of them perhaps thinking about voting for you, who want to get back to work right now?
I'd say we should not send you back to work till it's safe to send you back to work. This is a false choice. The way you revive the economy is you defeat the disease. And we have to get a number of new cases down where they are significantly down from where they are now. Social distancing is going to have to continue. We have to implement this Defense Production Act as a supply commander. Get them out there gathering all this data. We have to have widespread testing available, Willie. We've known that for the last 4 months. We have to ensure that hospitals are ready for a flare-up. We don't have to we said, well, we don't need the ventilators now. We're sending them somewhere else. The idea this isn't going to flare up is just preposterous. It's going to come back in some form or another. We got to be prepared. And what I'd be doing is convening the top experts in the country all together, including the private sector, and say, okay, what are you going to be doing in your place of business that, in fact, if we do have open up sectors of the economy, that it's going to be less likely anybody's going to be able to spread this disease. I would be making sure that we brought in OSHA to figure out how we can do protection for workers on the job when we get, and no matter what the job is. But most of all, Willie, I think you'd have to say to people, you know, look, we're going to make sure that mainstream can open back up, and when it does, you're going to have a job. That's why these programs that have been, the so-called CARES Act that got passed, the money has to get to ordinary people and ordinary small businesses, those people employing 2, 5, 10, 20 people. I know we have to help 500, small businesses or 500 or less, but the picture in my mind is opening up for most people is not knowing that a GM factory is functioning, which would be very important. Opening up is being able to get in their vehicle, drive down their main street, and see the coffee shop that's open, see the little sporting goods store that's still open, make sure the drugstore is open, make sure the people who in fact provided for the things that make up a community are open, particularly in small communities, particularly in communities that are minority communities, which need that grocery store, which need that drugstore, which need that coffee shop. It's both the social and the economic hub of who they are.
Yeah.
And we don't seem to be paying much attention to those folks.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.